beautiful people. Hello from Nurse UB. Thank you very much for always finding time to come to my channel, and I'm welcoming you to my channel today. Okay, and like I always say, if you're new to this channel, if you haven't been in this channel before, this channel deals with, we talks about, gives information concerning health related issues with emphasis placed more on cancer. Okay, so today I'm gonna be talking about the 14 warning signs of cancer. What I mean by warning sign is that the things you see that makes you to know that you should quickly go to see a doctor. Okay, and this may be some things you have noticed, maybe in a relative, in a friend, in a sister, in an uncle, in a daddy, your mommy, but you haven't paid attention to. Okay, so I'm going to go straight to the point. But if you're new to this channel, I am welcoming you so much to this channel, and I'm going to also urge you to subscribe by clicking on the subscribe button down below this video, and then you can help me turn on your notification bell so that you'll be getting notifications each time I post new videos. Thank you very much for always coming to my channel. Okay, number one warning sign that you notice when there is a change in the normal process in your body is that you're going to notice a low-grade fever. When I'm talking about low-grade fever, is that you notice that your temperature is rising above normal, the normal body temperature. And we have the normal body temperature, we have the range from 36.2 to 37.2. Any temperature above 37.2, 37.3, it's abnormal. So these are the things, and if you also notice you've been treating this and it doesn't go and you've been feeling quite sick for some time, I urge you to see a doctor, because there the doctor might notice what you never noticed. And then number two, you're going to notice a change in bowel or bladder habit. If you've been visiting the loo maybe once in a day, twice in a day, or maybe you visit the loo once in 2 days, but all of a sudden you find out that there is an abnormal or unusual change in your bowel activity. You go more frequently, or you don't even go at all, or maybe in your bladder habit you find out that you're having pain in your pelvic area when you're voiding. I urge you to visit a clinician so that we could check. The clinician, the doctor will check what is happening right in there and then commence treatment on time. Number three, you're going to notice unusual bleeding or discharge from any part of your body. Yes, there is always going to be something unusual whenever there are changes in a part of your body. So bleeding or discharge is one of them. You can find maybe you're bleeding from the nose, you're bleeding from the mouth, you're bleeding when you go to the loo, and you visit the loo, you find out that your stool is blood stained. Okay, so I urge you to visit a clinician because it is not normal. Then we go to number four. You find out that you have a sore that does not heal. When I'm talking about a sore that does not heal, is that you have a wound. Normally, you could have a cut, and the normal process is that it's supposed to heal, it's supposed to clot, but that in this instance you keep on treating the sore and the sore persists and possibly stay for more than 2 weeks to 1 month. You find out you're treating one little sore for 2 months and it's not going. I urge you to visit a physician. Also, there are instances where you have sores that doesn't heal in diabetic cases, but I also always urge us to visit a clinician so that we get properly treated. And then number five, you find out that you have a thickening or a lump in the breast, in your testicle, or any part of your body. This is not normal. You should visit a clinician, a dermatologist if it's in your skin, so that it should be treated. You'll be screened and then treated immediately before it becomes complicated. And then number 6, you'll be talking about indigestion or difficulty swallowing. Maybe you're feeling some discomfort after eating for a long time. You find out that you still feel heavy over here, nothing is moving down into your stomach, and then you find out that you're having difficulty swallowing. These are cases where you have maybe a tumor around in your tummy or around your neck area, your esophagus. So I urge us to always try to see a doctor so that we'll get treated on time. And the number 6, you find out that there is obvious change in the size, color, shape, or thickness of a wart, mole, or a mouth sore. There is a change in color of any part of your body, of the skin. Okay, there is like I always say, a thickening, or there is a mouth sore. These are things you tell a doctor, and then you get properly screened and then treated. Number 7 is that you find out you're coughing, nagging cough that persists for a long time, for quite a period of time. My sister, my brother, my friend, I urge you to visit a doctor so that you get properly managed. And then number 8 is when you're talking about unexplained weight loss. You lose weight so easily. You don't know why you're losing weight. Maybe you're eating well, you're doing everything fine, you're not sick, but you keep on dropping weight. Okay, so I urge you to visit a doctor. Number 9, when you're talking about number 9 is we are talking about coughing up blood. When you're coughing up blood, this is a danger sign that is telling you that you need to see a physician. Number 10, you experience a persistent fatigue, or maybe you're weak and tired, you get exhausted easily, in over little activities. I urge you to visit a physician. Number 11, you have repeated instances of infection. Any little infection that come your way, you grab it. This is not a normal sign. This is a warning sign that makes you know that you're supposed to visit a clinician. And then you talk about persistent headache. Persistent headache is number 12. In persistent headache, you find this when you're talking about the brain tumors, cancers in the head, in the brain, could make you feel headache. It could make you have pain in your head and you don't even know where this comes from. And this headache is not relieved when you take drugs. And you keep treating it for quite some period of time or period of days. I urge you to visit a clinician. And then you go to number 13. You have persistent nausea and vomiting. You talk about nausea and vomiting. You're eating maybe and you're vomiting with little food. You throw up with the food that you've been tolerating, the normal food that you like, but you see yourself throwing up. These also come in instances where you have some brain tumors. Okay, this could make you throw up and you do not tolerate food. And then number 14, we are going to be talking about discoloration. In a part of your body where where something is not normal and that thing has not been there before, there would always be a discoloration and there will be obvious tumor. There would always be an obvious tumor and then pain. That is number 14. There would be an obvious sign that you're going to see, that you know that this is not usual, this is not normal. So I urge us today, I summon us today, Sylvie is telling us today to visit a doctor so that you get treated. And like I always say, you should not get scared. Don't get scared. Cancer is not a death sentence. You can be treated. Yes, you can be treated and you can be cured. If you notice those warning signs early and then you visit the doctor on time, you're going to get treated and you're going to be fine and you're going to go about your normal activity. Okay, activities of the day. You can go to your work, you can take care of your children, you could do everything. You're gonna do your house chores, and you're gonna be fine. So this is what I wanted to drop today for us, so that we have this knowledge on time, so that we get treated on time and get managed on time and we get better on time. Thank you very much for always stopping by in my channel, for always stopping by to listen to my video, to listen to what I have to tell us. Please always find time to do this any other time I post a new video, and then help me share this video so that another person out there could get to reach out to this information. Thank you very much, as I'll be seeing you next time, same time, or any other time in the same channel. Shout out from Nurse Yubi. Bye. See you next time.